Hello friends, welcome all of you on my YouTube channel here Anand's Nursing File. Today in this video we'll learn about the nursing care plan on typhoid or enteric fever. This is very important nursing care plan. In this video we make here very easy or simple nursing care plan, and by this video you learn it easily, and this is useful for the examination purpose or for the practical work. तो फ्रेंड्स देखते हैं नर्सिंग केयर प्लान ऑन टाइफाइड फीवर और एंट्रिक फीवर. Nursing care plan on typhoid. Typhoid fever, also known as enteric fever. Typhoid fever is life-threatening infection caused by the bacterium Salmonella typhi. It is usually spread through contaminated food or water. Symptoms include prolonged high fever, fatigue, headache, nausea, abdominal pain, constipation, diarrhea, and some patient may have a rash. Here our topic: nursing care plan for typhoid fever. Here we use different nursing process steps. Here nursing assessment, diagnosis, goal intervention, additional and evaluation हमने लास्ट में लिखा हुआ है. तो आइए देखते हैं फर्स्ट नर्सिंग केयर प्लान. सबसे पहले देखते हैं नर्सिंग असेसमेंट. एयर सब्जेक्टिव डाटा पेशेंट वर्बलाइज अबाउट इनएबिलिटी टू perform purposeful activity. Objective data here assess patient's level of activity. On the basis of these assessment data, we write here the nursing diagnosis, and here nursing diagnosis is activity intolerance related to mandatory bed rest. गोल होगा the patient will practice in activity of daily living. गोल होगा यहाँ पर the patient will participate in activity of daily living. And next intervention rational to provide assistance to the meet first year to assistant to meet their daily need such as food, drink, change cloth and watch, oral hygiene, hair care and nails. यहाँ रेशनल होगा फर्स्ट इंटरवेंशन का टू अवॉइड द ऑनसेट ऑफ कॉम्प्लिकेशंस एसोसिएटेड विद द मूवमेंट. नंबर सेकंड इंटरवेंशंस देखते हैं एनकरेज एंड इन्वॉल्व द फैमिली इन द फुलफिलमेंट ऑफ द एक्टिविटी ऑफ डेली लिविंग. रेशनल होगा पार्टिसिपेशन फैमिली is very important to facilitate the nursing process and prevent further complications. Next देखते हैं नंबर थर्ड. Interventions explain the purpose of bed rest to prevent complications and speed up the healing process. Rational होगा rest decreases intestinal mobility, also decrease the rate of metabolism and infection. Number fourth interventions देखते हैं encourage for alternate rest activity. Rational होगा to conserve energy and increase activity. Number fifth interventions teach client and caregiver about range of motion exercise ROM as tolerate. Rational होगा improve client's strength and increase independence. Number six intervention होगा provide proper nutritious diet. Rational होगा provide support to muscle and bone. After providing these interventions, we write here the evaluation step of this care plan. Now here evaluation is now patient participate in activity of daily living. Next देखते हैं care plan number second here. Nursing assessment, diagnosis, goal intervention, rational assessment. First subjective data not applicable because this is the risk diagnosis. Objective data here assess vital sign, assess sign of fluid volume deficit, and assess intake and output. After assessing these data, we write here the nursing diagnosis, and here nursing diagnosis is risk for fluid volume deficit related to the intake is less, nausea, vomiting, excessive spending, diarrhea, body. To goal होगा to decrease risk for fluid volume deficit. नर्सिंग इंटरवेंशन और उसका रेशनल देखते हैं. फर्स्ट इंटरवेंशन मॉनिटर द स्टेटस ऑफ द हाइड्रेशन, मॉइस्चर ऑफ म्यूकस मेम्ब्रेन, स्किन टारगेट, एडिकेट ब्लड प्रेशर, ऑर्थोस्टेटिक इफ नीडेड. रेशनल होगा चेंजेस इन हाइड्रेशन स्टेटस, म्यूकस मेम्ब्रेन, skin target describe the severity of the dehydrations. Next second interventions monitor vital signs. Here rational होगा changes in vital sign to describe the general state of client. Number third interventions monitor the input poured liquid and count daily calorie intake. Here ration होगा provide guideline to replace fluid. Next, encourage for liquid nutritional supplement. Ration होगा to support to correct fluid and electrolyte and replenish calorie. Number 5 interventions. IV fluid administration as prescribed. Ration होगा giving IV fluids to meet the fluid needs. After providing these interventions, we rated the evaluation steps. Here evaluation is now decrease risk for fluid volume deficit. Next देखते हैं care plan number third. Here nursing assessment, diagnosis, goal, intervention, additional and evaluation जो हमने लास्ट में लिखा हुआ है. फर्स्ट नर्सिंग असेसमेंट में सब्जेक्टिव डाटा पेशेंट एक्सप्रेस देयर फीलिंग अबाउट द वीकनेस एंड टायर्डनेस. इट ऑब्जेक्टिव डाटा assess weight, generalized weakness, decrease activity. यहाँ पर ऑब्जेक्टिव डाटा होंगे. On the basis of these data, we write here the nursing diagnosis and their nursing diagnosis imbalance nutrition less than body requirement related to less intake due to nausea, vomiting, anorexia or diarrhea due to excessive output. गोल होगा to improve nutritional status. Nursing interventions and rational. First intervention देखते हैं assess the nutritional status of the patient. Rational होगा to determine the appropriate and effective intervention. Number second point is the weight loss. Rational होगा change in body weight reflect the degree of nutrition. Number third interventions provide calm and quiet environment during the meal. Here a comfortable environment can reduce stress and more conducive to eat. Conducive to eat. Number fourth interventions nausea and vomiting. Rational होगा nausea and vomiting affect nutrition. Number fifth interventions involve the family in the client's nutritional need. Here rational होगा increasing the role of the family in nutrition to accelerate the healing process. Number six interventions instruct the patient to enhance the protein and vitamin C. Rational होगा protein and vitamin C to meet nutritional need. Number seven interventions provide liquid nutritional supplement and food selected. Here rational होगा to correct fluid and electrolyte and to assist in fulfilling the nutritional need. Number 8 interventions assist the client with the mouth care here to maintain oral hygiene and help to increase client's appetite. Number 9 interventions encourage frequent small meal here rational होगा for easy digestion food and absorption of the nutrients. Number 10 interventions collaboration with the nutritionist to determine the amount of calorie and nutrients if need. Patient rational होगा help in the healing process. After providing these interventions, we rated the evaluation. Now, your evaluation is improved nutritional status. Next, देखते हैं care plan number 4. Here, nursing assessment subjective data. Patient complained about the abnormal pain. Here, objective data assess frequency, severity, and onset duration of pain. Patient express regarding and distraction behavior. On the basis of these data, we rated the nursing diagnosis. Here, diagnosis is acute pain related to inflammation of the small intestine. Go over to relieve pain. Next, nursing intervention rational. First देखते हैं assess the level of pain, location, duration, intensity, and characteristics of pain. Rational होगा changes in the characteristics of the pain may indicate the spread of the disease complications. Number second interventions review the factors that increase the pain and decrease pain. Here in rational होगा it can pinpoint the factor that trigger or aggravate such as stress, food intolerance, or identify occurrence of complications as well as help in making the diagnosis and therapeutic need. Number third interventions provide comfortable position to the patient. Rational होगा comfortable position provide relaxation. Number fourth interventions होगा provide non-pharmacological pain management technique like relaxation, diversional activity, guided imaginary. Rational होगा these techniques promote relaxation and relieve pain. Number fifth interventions होगा give warm compress on the area of pain. Here rational होगा for the pain relief. Number six intervention administer analgesics as prescribed. Rational होगा analgesics can help reduce pain. After providing these interventions, we rated the evaluation. Now evaluation is now patient relief. Now pain is relieved and patient feel comfort. Next देखते हैं number fifth care plan here. नर्सिंग असेसमेंट में सब्जेक्टिव डाटा देखते हैं. फर्स्ट, patient is saying that he is feeling warm. Objective data, vital sign assessment, patient having pyrexia 102 degree Fahrenheit. Here, nursing diagnosis hyperthermia related to infectious process, evidence by vital sign goal over to maintain normal body temperature. Nursing intervention rational देखते हैं. First intervention, assess the type of pyrexia, mild, moderate, severe. Rational का provide baseline information for interventions. Number second interventions, provide patient a noise free, calm and cool environment. A rational to reduce headache and maintain temperature. Number third intervention, encourage the patient to drink plenty of water. Here, rational to replenish fluid loss by fever. Number fourth interventions, provide a tepid bath or sponge bath to the patient. A rational to cool down body temperature. Number fifth, administer antibiotics and antipyretics medications as prescribed. Rational antibiotics prevent infection, antibiotics reduce the fever. After providing these interventions, we write here the evaluation steps. Now here evaluation is, now body temperature maintained to normal limit. Next, nursing care plan number 6. A nursing assessment, diagnosis, goal, intervention, rational. First, nursing assessment subjective data देखते हैं. Patient's family having no knowledge about the typhoid. After asking question, objective data, family member looking anxious. Nursing diagnosis here, knowledge deficit, condition of the disease, treatment and prognosis need related to lack of information or inadequate information. Goal होगा to improve the level of knowledge. Nursing interventions, rational देखते हैं. First intervention, assess the extent of knowledge of the client's family about his illness. Rational होगा knowing the mother's knowledge about the disease typhoid fever. Second interventions, give the health education about the disease and treatment of client. Here, rational होगा in order for the client's mother found out about the disease, typhoid fever cause, signs and symptoms, as well as care and treatment of typhoid fever. Number third, interventions give the family an opportunity to ask if there is not yet understood. Here, rational होगा in order to understand more about the family disease. Number fourth, intervention, review the need for safe drinking water and hygienic food. Here, rational होगा typhoid is spread through contaminated food and water. Number fifth intervention होगा emphasize the importance of the treatment process. Rational होगा therapeutic regimens as treatment of typhoid. After providing these interventions, we write here the evaluation steps. Now here evaluation is, now improved patient and their family knowledge. तो फ्रेंड्स ये था आज का हमारा वीडियो जिसमें हमने टाइफाइड का नर्सिंग केयर प्लान लर्न किया. तो एक बार फिर देखते हैं यहाँ पर सबसे पहले हमने शॉर्ट इंट्रोडक्शन बताया टाइफाइड का. नेक्स्ट यहाँ पर नर्सिंग केयर प्लान फर्स्ट नंबर था एक्टिविटी इंटॉलरेंस. नेक्स्ट नर्सिंग केयर प्लान सेकंड था रिस्क फॉर फ्लूइड वॉल्यूम डेफिसिट. नेक्स्ट नर्सिंग केयर प्लान थर्ड था एम्बेलेंस न्यूट्रिशन लेस देन बॉडी रिक्वायरमेंट. नेक्स्ट फोर्थ नंबर केयर प्लान था acute pain related to inflammation of the small intestine. Next fifth care plan था hyperthermia related to infectious process as evidenced by vital sign. And sixth care plan था knowledge deficit related to inadequate knowledge about the disease condition, treatment process, need lack of information and inadequate information. तो ये थे हमारे 6 नर्सिंग केयर प्लान्स फॉर टाइफाइड डिजीज और एंटरिक फीवर टाइफाइड फीवर. तो फ्रेंड्स आपको वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस वीडियो विद अवर फ्रेंड्स एंड सब्सक्राइब माई यूट्यूब चैनल आनंद नर्सिंग फाइल प्रिपरेशन फॉर द नर्सिंग कॉम्पिटिशन एग्जामिनेशन And in this AR, we provide various nursing related material, nursing recruitment examination related material, and nursing care plan, case history, community nursing, family folder, case history, and image based questions, and also many other material. तो फ्रेंड्स प्लीज़ चैनल को सब्सक्राइब कीजिएगा एंड बेल आइकन को जरूर प्रेस कीजिएगा, जिससे कि आपके पास हमारे सारे वीडियोस समय समय पर पहुंचते रहें। थैंक यू।